Amyotrophic lateral sclerosis. So, what is amyotrophic lateral sclerosis? So, this is the most common. It's a progressive motor neuron disease. So, what is it? It is the most common and it is a progressive motor neuron disease. So, this is a prime example of a neurodegenerative disease, and this is arguably the most devastating of the neurodegenerative disorders. So, this is the most common progressive motor neuron disease. It is a prime example of a neurodegenerative disease and it is the most devastating of the neurodegenerative disease. So, in the neurodegenerative disorders, it is the most devastating and it is a prime example of a neurodegenerative disease. And this is the most common progressive motor neuron disease. So, what is the pathological hallmark? So, what is the pathological hallmark of all the motor neuron degenerative disorders? So, the pathological hallmark is death of the lower motor neurons. So, death of lower motor neurons. So, what are these lower motor neurons? So, these consist of anterior horn cells in the spinal cord and their brainstem homologues, which are innervating the bulbar muscles. So, whatever the lower motor neurons which are present in the brainstem, which are innervating the bulbar muscles. And apart from lower motor neurons, there is also involvement of the upper or corticospinal motor neurons. So these upper or corticospinal motor neurons, they are originating in the layer 5 of the motor cortex, and after this motor neurons originate from layer 5 of the motor cortex, they descend via the pyramidal tract to synapse with the lower motor neurons, either directly or indirectly via interneurons. So after originating from the layer 5, what is happening? So these motor neurons, they are descending via the pyramidal tract and they synapse with the lower motor neurons. So how they synapse? Either directly or indirectly via the interneurons. So what is the pathological hallmark? So the pathological hallmark is death of lower motor neurons and upper motor neurons. So although at its onset, ALS, it involves selective loss. So initially at its onset, what will happen is, so this amyotrophic lateral sclerosis, it involves only a selective loss of function of only upper or lower motor neuron. So initially only upper motor neuron or lower motor neuron will be involved. But later what will happen as the disease progresses, what will happen is, so there will be a loss of both categories of upper motor neurons. So as disease progresses, both upper motor neuron and lower motor neurons will be involved. So in the absence of clear involvement of both motor neuron types, then the diagnosis is questionable. So to make a diagnosis of amyotrophic lateral sclerosis, so there should be involvement of upper motor neurons or lower motor neurons. So in a subset of cases, this degeneration of upper motor neurons, lower motor neurons, along with that there will be a frontotemporal dementia. So in these instances, so there is a degeneration of the frontotemporal cortical neurons and there will be corresponding cortical atrophy. In a subset of cases, what will happen? Along with degeneration of upper motor neuron, lower motor neuron, there also will be a degeneration of the frontotemporal cortical neurons and corresponding cortical atrophy. So other motor neuron diseases involve only particular subset of motor neurons. So if we take the bulbar palsy and spinal muscular atrophy called progressive muscular atrophy. So in bulbar palsy, what will happen? The lower motor neurons of the brainstem, in brainstem will be there, no? So in the brainstem, lower motor neurons will be there. So when those are affected, so this results in bulbar palsy. And in the spinal cord, if lower motor neurons are involved, so this results in spinal muscular atrophy. So by contrast, pseudobulbar palsy, primary lateral sclerosis and hereditary spastic paraplegia affect only upper motor neurons innervating the brainstem and spinal cord. But in pseudobulbar palsy, primary lateral sclerosis and hereditary spastic paraplegia, what will happen? Upper motor neurons are involved. So if we take this, if there is involvement of both upper and lower motor neurons, so this is called as amyotrophic lateral sclerosis. If there is predominantly upper motor neuron involvement, so this is called as primary lateral sclerosis. If there is predominantly lower motor neuron involvement, so this is multifocal motor neuropathy with conduction block, motor neuropathy with paraproteinemia or cancer, and motor predominant peripheral neuropathies. If there is a predominant lower motor neuron involvement, so this is called as multifocal motor neuropathy with conduction block, motor neuropathy with paraproteinemia or cancer. So in these cases also there is predominant lower motor neuron involvement. And motor predominant peripheral neuropathies also, so predominantly lower motor neuron involvement. So what happens in this in each of these diseases? The affected motor neurons, what will happen in the motor neurons? They will undergo shrinkage. Motor neurons, they undergo shrinkage with accumulation of the pigmented lipid lipofuscin that normally develops in these cells with advancing age. Generally, when there is advancing age, what will happen? These cells they have this pigmented lipid, but here because of this disorder, so this pigmented lipid will accumulate early and the affected motor neurons undergo shrinkage. So the in ALS, amyotrophic lateral sclerosis, in amyotrophic lateral sclerosis, so there is upper and lower motor neuron involvement is there. So in amyotrophic lateral sclerosis, the motor neuron cytoskeleton is typically affected early in the illness. So early in the illness, what is involving? So in the motor neuron, there will be a cytoskeleton. So that will be affected early in the illness, and there will be a focal enlargement is frequent in the proximal motor axons. In the proximal motor axons, what will be there? There are focal enlargements. So what ultrastructurally, what is this focal enlargement? This focal enlargement is nothing but spheroids, which are composed of accumulations of the neurofilaments and other proteins. So in the spheroid, so what does the spheroid contain? It contains accumulation of neurofilaments and other proteins. Focal enlargement, so these are frequent in the proximal motor axons. So commonly in both sporadic and familial ALS, the affected neurons demonstrate ubiquitin positive aggregates typically associated with the protein TDP43. So either if amyotrophic lateral sclerosis, either if it is a sporadic amyotrophic lateral sclerosis or if it is a familial amyotrophic lateral sclerosis, what will happen is either in sporadic or familial, the affected neurons, no, they demonstrate ubiquitin positive aggregates. So in the neurons, what will happen? Neurons, okay, what will happen? Ubiquitin positive aggregates. So this aggregates, they will be associated with the protein TDP43. So what will be there? Ubiquitin positive aggregates will be there. They'll be associated with the protein TDP43. And what else can be seen? The pigmented lipid also can be seen. So what happens early in the course of the illness? Motor neuron cytoskeleton is typically affected. So what are these focal enlargements in the proximal motor axons? So these focal enlargements are spheroids. So what does the spheroid compose of? Are composed of neurofilaments and other proteins. So what happens in amyotrophic lateral sclerosis? Both upper and lower motor neurons are involved. So along with the motor neurons, what else can be seen? There will be proliferation of the astroglia and microglia. So in all degenerative process, degeneration will be going on. Along with that, you can also see the proliferation of the astroglia and microglia. So this will be a inevitable accompaniment. So degeneration will be there, and there will be proliferation of astroglia and microglia. So the see, if there is a death of the peripheral motor neurons in the brainstem and spinal cord, so what does this lead to? So this will lead to obviously denervation and atrophy of the corresponding muscle fibers. So if nerve is there, so if that proximal motor neuron is getting degenerated, even the muscles are also affected. So if you see histochemical and electrophysiological evidence. So in the early phases of the illness, denervated muscles, no, so the muscle which is denervated, it is re-innervated by sprouting from the nearby distal motor nerve terminals. So although this re-innervation in this disease is less extensive, so if we take this motor neuron amyotrophic lateral sclerosis, the re-innervation in this disease is less extensive than in most other disorders affecting the motor neurons, poliomyelitis and peripheral neuropathy. So in these disorders, what will happen? There will be a re-innervation. So as denervation progresses, muscle atrophy is readily recognized in muscle biopsies. So if we take the muscle and if we do a muscle biopsy, what you can see, so there will be a denervation. So this is basis for the term amyotrophy. So because of this degeneration of the muscles, what will happen? So this is called as amyotrophy. So amyotrophic lateral sclerosis. So what is happening? The loss of the cortex motor neurons will be there, no? So if there is a loss in the motor neurons in the cortex, what will happen? So this will result in thinning of the corticospinal tracts. If motor neurons are lost, the tracts are thinned. So because these tracts, they travel via the internal capsule, and these tracts are traveling in the pyramidal tracts in the brainstem. So you know this corticospinal pathway, no? So from cortex, internal capsule, pyramidal tracts in the brainstem, and then to the lateral and anterior white columns of the spinal cord. So how they, from where they are traveling? So this upper motor neurons, the cortical motor neurons in the loss will be there. So these corticospinal tracts are traveling from the internal capsule and pyramidal tracts in the brainstem to the lateral and anterior white matter columns of the spinal cord. So this loss of fibers in the lateral columns, so what will happen? So in the lateral and white matter columns, what is happening? So there is a loss of fibers. So the loss of fibers in the lateral columns and resulting fibrillary gliosis. So if the fibers are lost, it will be replaced by some fibrillary gliosis. So because of this, what is happening? There is a particular firmness. So this is called as lateral sclerosis. Muscles are atrophied, and the degenerated columns are replaced by a fibrillary gliosis. So this is called as amyotrophic lateral sclerosis, which involves both proximal and upper motor neurons and lower motor neurons. So a remarkable feature of the disease is the selectivity of the neuronal cell death. What is the remarkable feature of this disease? So the remarkable feature of this disease is the selectivity of the neuronal cell death. So by light microscopy, if we examine by light microscopy, the entire sensory apparatus and cerebellar structures that control the coordination of movement remain intact. So only motor neurons are involved. The entire sensory apparatus and cerebellar structures that control the coordination of movement are remaining intact. So except in cases of frontotemporal dementia, the components of the brain required for cognitive processing are also preserved. So when this is associated with frontotemporal dementia, then the components of the brain required for cognitive processing is affected. Otherwise, if there is no frontotemporal dementia, cognition is normal. But what happens is the immunostaining indicates that neurons bearing ubiquitin, a marker for degeneration. So what is the marker for degeneration? So the marker for degeneration is ubiquitin. So this is also detected in non-motor systems, not. So though affected neurons are upper motor neurons, but this ubiquitin marker, ubiquitin a marker for degeneration. So this is also detected in the non-motor system. And if you do a study of glucose metabolism in illness, so there is a neuronal dysfunction outside of the motor system. So outside of the motor system, if you do this glucose metabolism studies, so there is a neuronal dysfunction outside of the motor system. So pathological studies, what they show proliferation of microglial cells and astrocytes in the affected region. So the motor neurons will be degenerated. There will be proliferation of the microglial cells and astrocytes. So this phenomenon, so this is called as neuroinflammation. So this can be visualized using PET scanning for ligands recognized by activated microglia. So within the motor system, and again within the motor system, there is some selectivity of involvement. So what are the motor neurons which are unaffected? The ocular motility remain unaffected. So thus motor neurons required for ocular motility remain affected, and also the parasympathetic neurons in the sacral spinal cord, that is the nucleus of Onofrovic or Onuf that innervates the sphincters of the bowel and bladder is also unaffected. So what does this parasympathetic neurons in the sacral spinal cord? Parasympathetic neurons in the sacral spinal cord. So this is called as Onuf nucleus or nucleus of Onofrovic. So this nucleus innervates the sphincters of the bowel and bladder. It is also unaffected. So bladder and bowel sphincters are not involved. Even ocular motility remains unaffected. There is proliferation of microglial cells and astrocytes with death of the motor neurons. So this proliferation of microglial cells and astrocytes, it is called as neuroinflammation. And ubiquitin, so this is a marker for neurodegeneration. So this muscles undergo atrophy, so this is amyotrophy. So there is a particular firmness, this is called as lateral sclerosis. A remarkable feature of this disease is selectivity of the neuronal cell death. So reinnervation in this disease is less extensive, whereas reinnervation in other disorders like poliomyelitis, peripheral neuropathy, it is extensive. See, what is this poliomyelitis? This also affects the lower motor neurons, but this is a acute process. So that is in poliomyelitis, herpes zoster, Coxsackie virus, West Nile virus. So all these viruses involves a lower motor neuron, and it is a acute process. But this process is amyotrophic lateral sclerosis is chronic, which involves both upper and lower motor neurons. So ubiquitin positive aggregates associated with protein TDP43. So this is about the pathology of the amyotrophic lateral sclerosis.